Please do not worry too much about hemorrhoids. They are actually very common indeed. Many people will experience them at some point in their lives. It is certainly nothing you should feel ashamed or embarrassed about. For some individuals, they are just a normal, though uncomfortable, part of life. This essay is designed to help you understand them much better. We want you to feel more informed and confident after reading this. We will carefully discuss what treatments actually work well for relief, and we will also cover what does not work so effectively for this condition. So what exactly are hemorrhoids? Simply put, they are swollen veins. These particular veins are located in your lower rectum and around your anus. You can think of them as being similar to varicose veins that some people get in their legs. However, hemorrhoids are found in a very different and more sensitive location. This swelling of the veins can unfortunately lead to discomfort. It might also cause bleeding, especially during bowel movements. Hemorrhoids can be located inside your rectum, or they can be outside around the anal opening. We will explain more about these types soon. Why do these veins become swollen and cause problems? There are several common reasons why hemorrhoids can develop. Straining hard during bowel movements is a very significant factor. This straining puts a lot of extra pressure on the delicate veins in that area. Pregnancy is another common time when hemorrhoids appear. The growing baby puts increased pressure on the pelvic region and its veins. Sitting for very long periods, especially on the toilet, can also contribute to their formation. Additionally, frequently lifting very heavy objects can increase your risk over time. Now, let's talk about a common myth. You might have heard various things about what causes hemorrhoids that are not actually true. For instance, a popular belief is that sitting on cold surfaces like a cold stone bench can cause hemorrhoids. This is a widespread myth, but it is not supported by medical science. Hemorrhoids are primarily caused by increased pressure on the veins in your rectal and anal area. They are not directly caused by exposure to cold temperatures, so you do not need to worry about cold seats causing this issue. It is better to focus on the real known causes we have already discussed. It is helpful to know that there are mainly two types of hemorrhoids. The first type is called internal hemorrhoids. These ones form deep inside your rectum, where you usually cannot see or feel them. They are generally painless. This is because the area high up in your rectum has very few pain-sensing nerves. The most common and often only sign of internal hemorrhoids is bright red blood. You might notice this blood on the toilet paper after you wipe, or you might see it in the toilet bowl after you have had a bowel movement. The second type is known as external hemorrhoids. These develop under the skin around the outside of your anus. This area has many more pain-sensing nerves compared to the inside of the rectum. Because of this, external hemorrhoids can often be quite uncomfortable or even painful. They might feel itchy, or the area might become irritated and sore. Sometimes, a blood clot can form inside an external hemorrhoid. This condition is called a thrombosed hemorrhoid. It typically causes a sudden, quite severe pain, and you may feel a hard, tender lump. So how can you try to tell these two types apart? If you are experiencing rectal bleeding but you do not feel any pain, it is very often a sign of internal hemorrhoids. On the other hand, if you suddenly develop a painful lump that you can feel around your anus, this more likely indicates an external hemorrhoid. This is especially true if the pain came on quickly and is intense, suggesting it might be thrombosed. Sometimes internal hemorrhoids can prolapse, which means they stretch down and bulge outside the anus. If this happens, they can also cause pain and irritation. Understanding why knowing the difference between these types is important can be very useful. It is important because the type of hemorrhoid you have often guides the best treatment approach. Painless bleeding from an internal hemorrhoid might be managed differently than a suddenly painful external lump. Knowing the type also helps you to communicate more clearly and effectively with your doctor about your symptoms. Furthermore, it helps you to have a better idea of what to expect from your condition and potential treatments. This knowledge empowers you to seek the most appropriate care for your situation. It is very important to understand when you should see a doctor. If you notice any bleeding from your rectum, you must make an appointment to see your doctor. This is true even if you strongly suspect that it is just due to hemorrhoids. Rectal bleeding can sometimes be a symptom of other, more serious medical conditions. Your doctor is the only one who can perform the necessary checks to find the true cause of the bleeding. Please do not try to diagnose the cause of rectal bleeding by yourself. It is always best to get it checked by a medical professional. When you visit the doctor's office, they will usually begin by talking with you. The doctor will ask you detailed questions about the symptoms you are experiencing. They will want to know about any bleeding, such as how often it occurs and how much blood you see. They will also ask if you have any pain, lumps, itching, or other discomfort. Your doctor will also inquire about your general medical history. They may also ask about your family's medical history. It is important to be open and honest when answering these questions to help them. After discussing your symptoms and history, the doctor will likely need to perform an examination. This examination usually includes a visual check of the anal area to look for any external signs. They might also perform a digital rectal exam. For this exam, the doctor will gently insert a gloved, lubricated finger into your rectum. This allows them to feel for any lumps or other unusual findings inside. Sometimes, if needed, a short lighted tube called an anoscope might be carefully inserted. This instrument helps the doctor to get a clearer view of the inside of your anus and lower rectum. For external hemorrhoids, you might sometimes be able to feel a lump yourself. This could happen when you are wiping after a bowel movement or when you are washing the area. An external hemorrhoid might feel like a small, soft or firm pea-sized or grape-sized swelling near the opening of your anus. If it becomes very painful quite suddenly, it could be a thrombosed external hemorrhoid. However, please remember this carefully. Even if you can feel something that you think is an external hemorrhoid, a doctor's visit is still absolutely crucial, especially if there is any bleeding or severe pain, to confirm the diagnosis and rule out other problems. The main and often most effective treatment for bleeding internal hemorrhoids is usually quite simple. It primarily involves increasing the amount of fiber in your daily diet. Dietary fiber plays a very important role in your digestive health. Fiber helps to make your stools softer and also adds bulk to them. When your stools are softer and bulkier, they can pass more easily through your rectum. This means you will likely strain much less during bowel movements. Less straining translates directly to less pressure on the delicate hemorrhoidal veins, which can help stop the bleeding. A specific food that is often recommended and works very well for increasing fiber intake is all-bran Bud cereal. Many doctors suggest eating about half a cup of this cereal each day. This amount provides a substantial dose of fiber that can make a real difference. If you make this change, you should start to see an improvement in bleeding within a few weeks. For a large number of people, this simple dietary adjustment works wonders for their hemorrhoids. The success rate for stopping bleeding from internal hemorrhoids with a high-fiber diet is quite high, often around 80%. Remember to also drink plenty of water when increasing fiber. Sometimes, however, dietary changes alone might not be completely sufficient to stop the bleeding. The bleeding might persist even after you have consistently increased your fiber intake and are drinking enough fluids. In these particular cases, your doctor might suggest considering another step in treatment. A common and effective next step is a minor procedure. This procedure is called elastic band ligation, or sometimes it is referred to as rubber band ligation. It is a straightforward procedure that can usually be done right in the doctor's office during a regular visit. So, how does this elastic banding procedure actually work to treat hemorrhoids? During an elastic band ligation, the doctor uses a special small instrument. With this instrument, they carefully place a very tiny rubber band around the base of the bleeding internal hemorrhoid. This rubber band then tightly constricts the hemorrhoid at its base. This action effectively cuts off the blood supply to that specific hemorrhoid. Without its blood supply, the hemorrhoid begins to shrink down. Eventually it shrivels up and falls off, typically within about a week or so. You might not even notice when this happens. For those painful external hemorrhoids, a very good and readily available drugstore remedy is witch hazel. Witch hazel is a natural product that comes from a plant, and it acts as an astringent. What this means is that it can help to gently shrink body tissues. It can also effectively reduce swelling and inflammation in the affected area. Using witch hazel can help to soothe the annoying pain and itching that often comes with external hemorrhoids. It often provides a welcome cooling relief to the tender and irritated skin. Many people find it to be very helpful for managing this discomfort. You can find witch hazel available in a few different forms at your local pharmacy. Medicated pads that are pre-soaked in witch hazel, such as the brand Tux, are very popular and convenient. You can gently wipe the affected anal area with these pads after bowel movements or as needed. Or, you can fold a pad and leave it in place against the hemorrhoid for a while for prolonged contact. Witch hazel is also sold as a liquid, which you can apply carefully with a clean cotton ball. Taking warm sitz baths, which means sitting in a shallow tub of warm water for 10 to 15 minutes, can also help. And remember, a high-fiber diet is still very important to prevent future flare-ups. There is also a newer type of treatment option that has been getting some good reviews from users. This option involves substances called flavonoids. Flavonoids are natural compounds that are found in many plants, including fruits and vegetables. For treating hemorrhoids, they are usually taken as oral supplements, meaning you swallow them as a pill or capsule. You can often get these flavonoid supplements over the counter at pharmacies or health food stores, or you can purchase them online. A common formulation combines diosmin and hesperidin. Some brand names include Daflon, but generic versions are often available too. People seem to like these flavonoid supplements because they report that they can reduce hemorrhoid symptoms. Scientists believe flavonoids may work by helping to strengthen the walls of the veins. They might also help to reduce inflammation and swelling in the affected tissues. This action can potentially lead to a reduction in pain, swelling, itching, and even bleeding associated with hemorrhoids. However, it is extremely important for you to remember the following disclaimer. This essay is provided for your general information and understanding only. It is not and should not be considered medical advice. Always talk to your own doctor before trying any new treatment for hemorrhoids or any other health condition.